Hi, it's Dr. K1 from Parliament. So I'm here to talk about what the alternatives are to fillers and Botox and toxins for hydrating and nourishing the skin. A lot of people are interested in not doing any fillers whatsoever or any toxins whatsoever to their face. Or some people may be wanting to complement their existing treatments, which may have involved Botox or fillers in the past, to boost their skin quality. And I'm here to talk about how we can do that without using more fillers or more toxins. First of all, something we need to address. What are toxins and what are fillers? So toxins are things like Botox, which help to relax the muscles of our face. And they use a very specific chemical that essentially paralyzes our muscles. That works for a period of time and that can improve our skin quality. Fillers can be a variety of different things, and they can be permanent, semi-permanent, but essentially they're referred to as implants. And the more common fillers that you may have heard of are the ones that contain hyaluronic acid, but also very specifically a BDDE protein, which cross-links and causes this to be an implant rather than just hyaluronic acid, which is in your skincare. So that is the difference between fillers and Botox. This then leads me on to discussing what skin boosters are, which are completely different to both of those things. So as we age, we see a decrease in collagen over time in our skin. We start to see fine lines around our areas of our face which are hypermobile, essentially around the eyes and around the mouth. And we start to see hollowness in certain areas of our face. This is where people may use things like fillers to address volume loss. People may use Botox to address the movement of our facial muscles, which may lead to lines and wrinkles. But as I said, I'm here to talk about skin boosters. Remember, despite having movement in our face, when we're young, we don't seem to have these lines. And why is that? Is it because we're not moving our face when we're young? That's not true. Is it because we have a lot more volume in our face? Possibly. There are some people, as you're aware of, things like baby fat, and people when they're younger have more supple skin. But you may see even in very young and thin people that those lines aren't present when they're smiling or when they're raising their brows or whatever they may be doing. And actually even within very thin and slim people, when they're young, their volume loss isn't apparent in a way that looks as though they've got hollowness in their under eye or hollowness around their nose to mouth lines. So what is the difference here? Well, the reality is that when we're younger, our collagen and our elastin are a lot stronger. It's sort of healthier, it's more resilient. And also the hydration and the nourishment underneath our skin, the layers within our skin, is better. Then we can talk in further detail about things like our fat pads, which are beneath our skin, which are placed in certain ways when we're younger, and they start to move when we get older. The muscle layers, the bone layers, the bone can resorb over time. So there's different stages to aging and different ways in which then leads to us having hollowness and lines. How can skin boosters, how can something that's not a filler, that's not a toxin, how can that be used to address signs of aging? Here we can start discussing this in more detail. If we use hyaluronic acid, which is present in skin boosters, without the filler component, so not cross-linked, not acting as an implant, we can actually hydrate and nourish the layers of the skin. If we use peptides, we can signal to cells and fibroblasts to produce more collagen to work better together. And if we use vitamins, we can help nourish the skin cells in order to be able to do what they're best at, which is to have healthy looking and glowing skin. And then we can come over to components within some skin boosters, such as polygarbolatic acid, which can actually act as a strong collagen stimulator. And so then we can talk more about, beyond peptides, how we can stimulate collagen further. So in a nutshell, skin boosters are there to help nourish, hydrate, and stimulate the collagen within our skin without staying as an implant. So not changing the plumpness or the shape of our face or our skin without leaving toxins which paralyze our muscles, so we can still move and express our face in the same way. But then effect of a skin booster is essentially like reversing the years of aging, which is to hydrate and make the skin more supple. A lot of people ask, how long does this last? So this isn't, again, a filler. This is not an implant. This is not a toxin. It's not got an expiry date per se. It is there to boost your own collagen and to hydrate your skin. So yes, we're aging all the time. So yes, we're still going to need to have more treatments over time. So we're going to need to do sessions. And this can be repeated initially after 4 to 6 weeks after your first treatment, and then beyond that you can do it every 3 to 6 months, and it varies person to person depending on their needs. So a person who's a lot older, who's not had any treatments before, may need this in a more intensive way every 4 to 6 weeks for a certain period of time, but someone who's a bit younger, looking to just be preventative, already has got good skin health and has already got good hydration levels, may just need this once every 6 months to a year. So again, it really depends, and this is where a consultation may be useful. I am a big believer in skin boosters. I've had skin boosters myself, and I really truly believe that if you use them in the right way, you can actually get an amazing quality of skin. You can prevent the need to use things like Botox and fillers for longer because you're already boosting your own collagen levels. So this is a treatment that's great for people who are worried about using Botox and fillers too early, or who don't want to use those toxins or fillers at all and they want to keep it as subtle and as natural as possible. This is a great treatment for you. You can have this as often as you want. It will not change the shape of your face. It will not change the contours of your face. It's there really and truly to hydrate your skin and give your skin the best chance of fighting aging. It's also great for those who've already had Botox, who've already had fillers, and are going to continue to use Botox and fillers for whatever need that they may have, but want to further prevent the effects of aging, as I said, dehydration, dullness of the skin, and to give yourself that extra boost. This is where skin boosters comes in. This can also be used in areas of the face, any area of the face where you've got concerns. So things like the lips. We've talked about lip fillers in the past, which are essentially, again, similar to fillers of the face, implants which change the volume and shape and size of the lips. Whereas lip booster, like the skin booster, is there just to hydrate and moisturize and nourish the lips to give them the healthiest looking appearance. So hopefully that summarizes and gives you an introduction to what skin boosters are. I have to say that there is a lot more to learn about skin boosters. This really has just been a nutshell. And we can also talk about the different ways to administer a skin booster. We can talk about how the use of needles or cannulas or mesotherapy approach to skin boosting. We can talk about the wide range of different skin boosters that are out there. The most common form of it that a lot of people have heard of and talk about is Profilo, which is administered in the 5-BAP technique around the face. But again, as I mentioned, there are different ways. So there is mesotherapy delivery of skin boosters, which is using a needle in very tiny, small amounts of the product injected superficially all around the face, similar to a bit of microneedling, but actually termed mesotherapy because it works on the very, very superficial layer of the skin. Then there is the microbolus approach, which uses slightly more amounts than mesotherapy, but injects underneath the very surface of the skin and leaves a small, tiny blob or bolus, a bit like how you'd administer Botox, but very much on the surface of the skin all around. And this takes a few days to weeks to really show the results, but again, can give a very great superficial hydration of the skin. Then there's the 5-BAP technique I mentioned with Profilo. This goes slightly deeper into the dermis, but still into the dermis, so still quite superficial, and this can address the common areas of aging and help to lift the skin. And then there's the cannula approach, which is what you've seen in some of our videos. And this is one of my favorite ways of administering skin boosters because you get the result immediately. There's almost no downtime and you get very healthy looking skin in exactly the areas that we need it to be. We can deliver the skin booster very targeted into those areas, but at the same time using the cannula, we can stimulate the collagen underneath the skin through the way that we use the cannula as well, through my very special technique. I can go through this again in more detail in person through a consultation, but that's the first step, is to actually book a consultation so we can discuss this in more depth. In terms of products we use, a lot of people ask, from what would work best on me or what would work best on a certain individual. That's, again, a consultation is necessary. There are lots of different products. There's Redensity 1 by Dioxide, there is Profiler, there is Gallery, which is using polycarbonate acid or PCO, and there are Nourishes Hydro Deluxe, which uses a combination of hyaluronic acid and calcium hydroxyapatite. Again, such a wide range of products out there, and this is why a consultation and a bespoke treatment approach will be needed for each and every person in order to decide how best to boost the quality of your skin without using toxins, without using fillers.